Good morning, everybody. We'll get started. My name is Libby Saunier Neto. I'm the Executive Director of the Louisiana Policy Institute for Children. We at the Louisiana Policy Institute for Children are a 501c3 nonpartisan nonprofit organization dedicated to ensuring that Louisiana's young children are ready for success in school and in life. We are an independent source of data, research, and pertinent information for policymakers, stakeholders, and the public at large around issues related to young children in Louisiana. The Policy Institute also develops policy proposals informed by research, best practices, and the experience of other states, and conducts educational and outreach activities around these recommended policy solutions. And that's what makes us thrilled to be able to partner with the First Children's Finance today to hear and learn about crisis management business strategies for child care centers. There will be a question and answer opportunity at the end of the presentation today that I will help facilitate. This webinar will be posted on our website at thepolicyinstitutela.org along with a copy of the presentation. And without further ado, let me introduce you to Heidi and Molly from First Children's Finance. Kick it away, ladies.
Thank you, Libby. This is Molly Sullivan. I am the Director of National Initiatives at First Children's Finance, a 30-year-old nonprofit institution that started in Minneapolis, Minnesota, but now serves states and communities across the country. We want to first and foremost say that we hope you are all doing as well as possibly can be under the circumstances. We'll be providing some information today specifically for child care providers to help them make business decisions. Heidi, would you like to introduce yourself?
Good morning, everyone. I'm Heidi Hagelbraid, and I'm the Chief Program Officer at First Children's Finance, and I'm really happy to be with you this morning. Thank you for the invitation, Louisiana.
We can move to the next slide. So First Children's Finance works at 3 different levels. One, on the individual level with childcare businesses, whether it's a large center, an independent person providing childcare in their home, and everything in between. We also work at the community level. We work specifically with communities and groups of stakeholders there to help them address their own childcare issues. We facilitate a community engagement process, which helps them create a solution to whatever childcare issues they're facing, which is specifically right for their community. And then we work on a systems level. We work with the federal government, state governments, and organizations that are advocating for childcare providers across the country. We can go to the next slide. So as you all know who are listening in today, childcare is a small business with just an enormous impact. You know from the care that you provide to children and their families every single day how crucial your work is to the well-being of your community and to the economy of wherever you live. It's experiencing enormous changes at this moment, and so we're hoping to provide some information to alleviate some stress and to provide additional training to you to make the decisions you need to make. Next slide. So as I've already covered a little bit today, we hope that today's webinar accomplishes a few things. One, provides a little bit of information for all of you to make financial decisions or to use financial data to make decisions. We hope that we'll cover managing your program when you have reduced enrollment, reduced staffing, some kind of reduced operation situation. We'll discuss managing the temporary closure of a program, whether you voluntarily or involuntarily closed your program. We'll talk about how to plan for the reopening of your program. We're not quite sure what the situation will be whenever you reopen or fully re-enroll, but we want to provide some information to help you get ready for that whenever and however it happens. And we want to explore accessing emergency operating capital. How can you get the money that you need to keep your operations going? Next slide. So, as in many states across the country, there have been some temporary changes in how childcare is either funded or how it's regulated. So in Louisiana, up until this, this moment, there hasn't been a mandatory closure, but there has been a change in group sizes. Providers have been encouraged to provide care for children of essential workers. In every state, essential worker is being defined by the governor and the government differently. There's been a temporary emergency CCAP or subsidy expansion. There's been some work to certify new family and in-home providers. And there are very new two relief grants that have been launched. One is the Emergency Childcare Relief Grant, and one is the Emergency Childcare Development Fund Response Grant. There is information all over the Louisiana Department of Education website, which provides you details about who's eligible, how much money per child or family each provider would receive for each of those grants. Next slide. There's also a state level loan program, which we just wanted to make sure that providers were aware of. The federal funding, the Payroll Protection Act, and the Emergency Disaster Injury Relief loans have been widely covered in the news, but from the providers who our organization, First Children's Finance, works with, we haven't heard of more than a handful of childcare providers being successful in achieving that funding. So we wanted to make sure that any state level funding that's specific for Louisiana, you were aware of. So there is apparently a loan pool of $50 million that eligible small businesses can apply to receive. And you can see that the partners are all at your state level. It's Economic Development, the Bankers Association in your state, and the Public Facilities Authority. A full list of the financial institutions who can make those loans is available at the website that's in the link there. So you should be able to see if a financial institution you're already a part of is providing any of those loans. We can move on. Okay, so before we get into the real heart of this webinar, we want to acknowledge that as we've seen, things change every day. So for example, when Libby and Heidi and I were first in conversation, those two childcare relief grant programs were not publicized yet. And in the putting together of this presentation, those were launched. So things change frequently. Things may be changing for you frequently. The information that we're presenting today may or may not be relevant to you in the coming weeks, but the financial decision-making information that Heidi is about to present will likely be helpful in the coming weeks and months. We're not advising anyone to open, close, stay open, change enrollment, change any of their operational practices, or defy any of the orders that are active in your state. And we just want to acknowledge there is a lot of information flying around there. So we hope that you're able to take a deep breath before we launch into the heart of this. Get a pencil, a paper, have your laptop out, whatever note-taking device makes sense to you. Take some notes and be kind to yourself. As Libby kindly pointed out, this is being recorded and you have a chance to ask questions at the end and rewatch and re-listen so that you can take it at your own pace. Okay, with that, I will turn it over to Heidi Hagelbraid.
Good morning, everyone. I am just really excited to be with you, and I'm going to move through this information fairly quickly this morning, mostly because I know it's recorded and you can come back to it. So if there's a slide where you're wishing that you could see it a little bit longer, don't worry. You're going to be able to go back and watch a recording. And also, I want to make sure that we get through all of the information and have some time for some questions. So don't be put off by the pace of the conversation as we go through these slides. One of the first things that I will recommend to you is this is a really tough time, and it is also a time in which you are taking in a lot of information and have to make a lot of decisions. And now is the time to be proactive and to make plans. Best case scenario, worst case scenario, and everything in between. Next slide, please. One of the things that is critical during a time of crisis is the understanding that cash is king. Now, if you were to have met Molly and I 6 months ago, we would be talking about a long-range plan for your business. But in the middle of a pandemic, the cliche, cash is king, has never been more true. And it is how we are operating currently for many of us as we're looking at our bills we have to pay and the income that we have. Cash is the most important measure of what we can manage at this moment. I think it's important to recognize that businesses who were struggling before COVID-19 are particularly vulnerable. So if you had low cash reserves or unstable cash flow before this health crisis, you may certainly be feeling the pinch of uncertain or low cash currently. Next slide. One of the things that I think is important is to take a look at how much cash you actually have. And you can identify how many cash buffer days you may have. And a cash buffer day is really the number of days that your business could pay out of its cash balance without any additional income coming through the doors. Now, according to JP Morgan Chase, the average small business has 27 days of cash on hand. But small businesses that they were looking at were a large range. And I think that childcare in general falls under this next category, where about 25% of small businesses have less than 13 days of cash on hand. And I think that's probably maybe more where most childcare centers are falling, is somewhere in between that 13 to 27 days of cash on hand. And then the Federal Reserve Bank just made a note about the number of American families that have $400 of liquid assets of cash. And if you are thinking about family child care providers, that is probably a good number to look at for them. Next slide. So what does that mean? How do you figure out the number of cash buffer days? So what you basically are looking at is your cash balance. And that is anything that you have as projected income, any cash you may have in a checking account or a savings account, any cash that you have for your business, you add that all together, and that is your cash balance. Your cash outflows are anything that you owe. So any bills, mortgage, rent, payroll, those types of things, you add up all of those, and that is your cash outflow. If you divide the cash balance by your cash outflow, that will give you the number of days of cash that you have on hand. Next slide. And if this feels really overwhelming, don't worry. We've got 2 links here. And the first link is most appropriate for you guys this morning. We have some tools here available for free on our website that allow you to download a guide that helps you to understand how to project cash flow. Next slide. Now, let me just acknowledge that many people who are in our field, and this may be your sort of origin story as well, come to this work because of their love for children. And they somehow found themselves operating highly complex businesses with small profit margins, and maybe are less comfortable with some of the financial management or operational tasks of their business. It isn't the place that you came from to get to this position that you find yourself in as the CEO of a childcare center. And this may feel uncomfortable and scary to you, but I want you to immediately move past the fear and think about what you can do and how to build your capacity to manage this situation. Next slide. So the first thing that we want you to do is to really use that cash mindset and think about how you can monitor your cash. And you should do this no less than weekly. And if you need to do it more frequently than that, please do. This is incredibly important, especially if you've already closed your program or you have reduced revenue due to lower enrollment. Next slide. And I want you to start to think about, in a very chaotic and uncontrollable situation, what can you control? And I always recommend that a childcare CEO thinks about a couple of different plans for best case scenario and worst case scenario. And let's be honest here, the best case scenario is not what we were thinking back in January of 2020. We're talking about the best case scenario that we have available to us in this crisis. So what is the best case scenario and what is the worst case scenario? And for many of us, the worst case scenario is closure, meaning that because of a outbreak or because of a change in our operating status, that our business is not open to children and families. Next slide. So as you make those plans around how to manage the best case and the worst case scenario, it's important to use financial information to guide your decision making. So in your best case scenario or multiple scenarios, what you're going to do is say to yourself, how long can I operate like this? How long can I lose money each week? Or how long can I continue to meet this ratio? Or how long can I employ this number of people if I don't have more enrollment coming in? So as you look at each one of those scenarios, just pull out a sheet of paper or an Excel spreadsheet, whatever feels most comfortable to you, and really just think about different scenarios and put some numbers to them. No one, and I mean no one, understands your business operations better than you do. So there might be some experts out there who can give you advice like Molly and I this morning, but really you're the person who knows the granular level of the dollars coming in and the dollars coming out. So move beyond the fear and just start putting the numbers down on a piece of paper or in an Excel spreadsheet. Once you've done the math and you know what your options are, here are some things that we think are critical for you to start to move on. If you have not done these things already, definitely add them to your to-do list for this week. Number one, negotiate short-term relief from your lenders. If you have a mortgage, if you are in a rental or a lease agreement with a landlord, if you have financed something for your business and you're paying a regular loan back, contact your lender and ask about options for short-term relief. Many financial institutions are providing interest-only payments, deferred payments, loan modifications. All of these are options for you. And what you're trying to do is just push out some of the repayment of debt so that you have the most amount of cash to you available right now during this crisis. Secondly, negotiate payment schedules with vendors and suppliers. I'm assuming that you've already moved down the amount of payables that you're currently using, right? You're probably not buying as much food. You're not buying as much consumable supplies. But if you have regular payments of something that is recurring month to month, look at how you can negotiate payment schedules with your vendors. Third, really move from a profit and loss mindset to a cash mindset. So typically, we're always trying to talk to people about moving beyond a cash mindset. But really in this situation, we're telling you to pay attention to your cash, look at that first and foremost and frequently. And fourth, conserve your cash. And we're gonna talk about why. But that's the most important thing, is to hang on to every dollar that you can during this crisis. On the right-hand side of your screen, here's some things that you should not do. We do not want you to pretend that the situation is going to resolve itself or it's going to go away, or if your state can fire up the economy, that everything's going to go back to normal. You absolutely have to step forward and start managing this situation, and it's never been more important than right now. Don't avoid lenders and creditors. I think that almost everyone is willing to work with you to find a solution. They want you to be successful. They want you to remain viable. And so don't be embarrassed. Don't think this is a reflection on your business management. This is a pandemic. All of the rules have changed. And so definitely pick up the phone and have those conversations. When you're having those conversations and you're negotiating short-term relief, make sure that you're realistic and honest about what you can pay and when you can pay it. Don't make a promise that you think is hopeful. Really just think about what's realistic for you in the current situation and share that with the people that you're working with. And lastly, we talked about some of the really great options that are coming from the federal government, some of the things that are happening inside of your state. But if you're not successful in obtaining any of those funding opportunities, be wary of things that sound too good to be true. If it's not coming from state or local government and it sounds like it is really amazing, but there has to be a catch, definitely ask a trusted financial advisor to look at it with you and help you understand what the catch might be. Read the fine print and look carefully for anything that may be a predatory financing term. And those will be out there. A crisis just brings them out, and people are desperate for cash. So just be careful and make sure that you're reading all of the details of those opportunities. Next slide. So if you're still operating currently and you have different group sizes and different ratios, let's talk about how you manage your business with reduced enrollment. Next slide. Many of you are probably serving essential workers, and if you've continued on, you have to think about a couple of things that are critical to the operation of your child care center. You have to be able to meet the ratios with staff who are healthy and willing to work. You also have to have the ability to ensure a healthy and safe environment, meaning that you have access to everything that you need to be able to make sure that your business is operating in a healthy and safe way, and that you have enough healthy staff who are able to meet the ratios. You have to be able to secure food for meals, and you have to have the ability to access the cleaning and sanitation supplies that you need to maintain that healthy environment. And you know, in childcare, we are obsessively cleaning all the time, but the protocols and the recommendations in this current situation are even more important to meet. And so if you are unable to access any of these 4 points, you may have to make some different decisions. Next slide. So here are the advice and recommendations that we have for you about how to operate with reduced enrollment. Number 1, think about how much income you need to have, that's those cash inflows, that you're going to need to have in hand to meet your financial obligations, all of the bills that you owe during this time. And I think it's important to really be realistic about the number of private pay families who are able to come to childcare. So even as we are thinking about a reopening strategy, you have to account for a reduced number of private pay families who are experiencing job loss or furloughs that may not be able to return to care in the same way that they were a few weeks ago. If you have employees, make sure that you are aligning your personnel costs to reflect reduced enrollment and the cash available to you for operations. Molly and I have both been hearing from providers across the country, from child care center directors and owners who are trying to keep everyone employed for as long as they can. And some of them have decided to pay everyone, regardless of whether they're open or if those people are working. And I want to caution you to evaluate that situation. We have no idea how long this pandemic will last. We have no idea if we will have periods of opening and closure as outbreaks may return again in the future. We may see other times in which we have to be closed. There is no recommended path that we can say for sure is going to happen. And so what we want you to do is to hold on to as much cash as you can. And if you are not able to match your personnel to your current enrollment, you run the risk of spending money that will close your business into the future. You absolutely need to conserve your cash. In case you have to shut down for a period of time, you are going to need that cash to start up again. So it is our recommendation that you do not deplete your financial resources by paying staff out of the goodness of your heart. Many times right now, we're finding ourselves in the strange situation of people being able to access more money through unemployment than they're actually able to earn in full-time employment with us. So think carefully about your staffing and making sure that you are aligning them to your current enrollment. Next slide. You may have to get creative about generating income. And if you are serving essential worker populations and you need more of them, you may need to market directly to those folks, healthcare workers, supply chain folks, law enforcement, firefighters, first responders, those kinds of people who are going to work every day and needing care. You may have to reach out to them and add them into your enrollment. You may also need to think about different operational hours. Do you need to extend hours? Do you need to allow for part-time enrollment or drop-in care? And let me just give you the caveat that you need to contact your licensing agency in your county or your state or however that works in Louisiana for guidance about how to shift your license if that is a requirement. And then finally, continue to monitor your cash flow and staff your program appropriately. Next slide. Now, let's talk about what it means for you and how to manage the temporary closure of a program. And this really is the worst case scenario. Next slide. All of us were hoping to avoid closure, but many of us have already experienced the voluntary or involuntary closure of the program. So if you are closed or you think you might have to close, here are some things to consider. Number one, make sure that all of your employees are aware of how to access unemployment and healthcare coverage options. And just because your program may be temporarily closed, it does not mean that your business is closed, and you as the business leader of your program still have a lot of important work to do. It's never been more important. And although you may not be seeing income coming into your business, it's still important to project cash flow and to conserve your cash as best you can. Next slide. So if you are finding yourself currently closed, you have to prioritize your expenses. And you want to first look at your facility costs, the rent and the mortgage first, particularly if you have other income that has been diminished. You want to negotiate the terms of any overdue expenses and just be in contact with any vendors, suppliers, or lenders that you are obligated to. Have direct conversations with them. Be honest again about what you can pay and when you can pay it. And let me just remind you that everyone is impacted by this pandemic. You should not consider this a reflection of your competency as a business leader. This has nothing to do with what you are capable of. Do not be ashamed and do not be embarrassed. Let me remind you that the CEOs of airline companies and major manufacturers are having these conversations, and they're in the exact same place you are. So you should not be feeling bad or allow that to stop you from having conversations. There are sympathetic ears, and people really want to help your business survive. So pick up the phone and take a deep breath and dial it and make those conversations happen. If you're closed and you are thinking about taking on new debt, even if it's one of the federal or state programs, if it is a loan and it has to be repaid, ask yourself about whether you can pay that back into the future or not. Be sure that you're borrowing money from a reputable lender, and look at your cash flow to make sure that in the future, when you're operating at full capacity again, without restrictions of group sizes or ratios, that you will be able to generate enough income to repay those loans. Next slide. As soon as you close, it's important for you to think about estimating the amount of capital, the amount of money that you're going to need to restart your program. And I think it's just a general rule of thumb that those who have a detailed financial idea of what it is that they need to sort of jumpstart the program again may be better positioned to obtain financing or philanthropic support. So on the left-hand part of your screen, here are some things that you may want to think about and put some numbers to. Do you need to do a deep clean or a sanitizing of your facility, particularly if you've had a COVID exposure that brought closure to your program about? There may be some costs there. You may need a resupply of food and consumable supplies. Probably the biggest line item is the amount of cash that you're going to need to cover the first couple of payrolls without additional income, right? You are going to open up your doors and the dollars may not be there on the first day. Families will enroll and you'll need a little bit of operating capital to float that first payroll. You may have some costs associated with hiring or recruiting staff because in a time of closure, people may have to take another job somewhere else to be able to pay their own bills. So you may not be able to keep all of the staff that you had prior to closure. And you may have some marketing costs associated with recruiting new families. So one of the things to think about is what are the amounts that you would spend here and know what you need to be able to start up. And so that you've got an idea of how much cash to hold on to, and also think about that payroll number so that you are borrowing the appropriate amount of money, or you're able to secure them from grant sources in your community. Next slide. I think it's important to consider what post-pandemic childcare will look like. And if I'm really honest, we're not exactly sure, but I do think there are a couple factors to consider. And one has to do with private pay families. Families will re-enroll in waves, and you cannot assume that everyone will be back in your program the moment that you are ready to open the doors. And for centers, it is absolutely crucial for you to match the personnel with the amount of children that you have enrolled. You're not going to be able to bring back everyone who was an employee right away. You're going to have to match those waves of re-enrollment with waves of rehiring. And just know that it will be a journey back to financial sustainability. And it's important for you to continue to project cash flow as often as it is helpful for you in your decision making. Next slide. Next slide. Let's start to talk about what it looks like to reopen your program. So you're closed and you are ready to open up the doors again, or you are in a diminished capacity or a reduced capacity currently, and you're getting ready to regain some of that capacity. I think if you've been in the field for a while and you happen to have been in the field long enough to remember the Great Recession back in 2007 and 2008 and the recovery period that followed, reflect on the lessons that you learned back then and allow those to guide your expectations for our economic recovery. Right now, we're in the health crisis, but what we are moving toward and pivoting to is the economic recovery and the economic crisis that will continue to happen for quite some time. We think safely it's somewhere between an 18-month and 3-year period of recovery. That does not mean that you're hemorrhaging money out of your program for 3 years. No one could survive that. But what that means is that it may take us a long period of time to get to 100% capacity in our programs. I'm hoping that it's shorter than that, but I think it's realistic to think conservatively and make sure that you are ready for a journey. It's not going to happen overnight. The great irony that we're experiencing right now is that the most stable enrollment and the best kind of financially viable enrollment that we have right now in the health crisis is low-income children. Government subsidized children are what are keeping many programs alive right now. And that is the exact opposite of what our business model typically looks like. We have depended on private pay enrollment in order to be successful for a long time. We're not sure what that's going to look like in the future. There are decisions to be made at the state and federal levels of government about what investment and public investment into the childcare sector will look like. But it's important for us to really be reflective on what the role of private pay childcare enrollment will look like. Families are struggling and they are experiencing unprecedented levels of unemployment. So it will take some time for them to come back into our business model. The timing of your state's economic recovery is largely unknown, but it's critical for you to pay attention to what the governor is saying about the reopening of, or the phased reopening of the economy, because your business model is closely tied to other people being back at work. If you have closed, you really should approach the reopening of your program like a startup, like a brand new startup. So if any of you have started a new program in the past couple of years, you are well suited to think about this in a similar way. And it means, how do you do a phased open? How do you project your enrollment as a phased approach? And that's really what we're going to talk about next. Next slide, please. So I just gave you some general things here of, if you talked about reopening your program in phases, you might want to think about it as 25% enrollment, 50% enrollment, 75% enrollment. In reality, it probably has many more phases than this, and you might be more gradual. This just fit neatly on a slide. You may want to think about 20, 40, 60, 80 to 100% enrollment. And again, the point that I keep repeating, but it is so important to your ability to survive this economic crisis, is matching the staff and the personnel to the enrollment. We don't know what reopening looks like. We have no idea if those ratios and group sizes will continue to be a factor or for how long. And so you have to think about a phased approach with best case and worst case scenario in mind. And although you will want to rehire everyone as quickly as you can, you have to have the children enrolled in order to make that happen. Next slide. Let's talk about grit. We think about grit and resilience with kids all the time. All the time. It's what we are doing in the four walls of our programs every day. And my job and Molly's job at First Children's Finance is really to help you to dig deep and to build your resilience as a childcare CEO, as an entrepreneur. Next slide. What we want you to do is to take a deep breath and know that you can do this. It's our job to help build your capacity. And I hope that this webinar has helped to encourage you in your capacity, in your confidence that you can do this. You have the capacity. So here are some just general thoughts as we end the formal presentation. And we're going to open up for some questions. But number one, use financial information to guide your decision making. The numbers don't lie. You have to use those numbers to guide your decisions. If you are thinking about reopening or closing, you have to crunch the numbers. And again, there isn't anybody who knows it better than you do. Our second point is that childcare is a unique model and it doesn't operate quite like other businesses. And so there are lots of well-meaning folks who will give you business advice. But I would tell you that it's important and critical for you to seek out someone who understands childcare operations. You can't just put infant slots on sale and run the blue light special. It doesn't work like that. You have to look carefully at ratios and group sizes to project your income and staffing. And that's the most important piece. And if you can put the numbers to that, you're going to be fine. But make sure that you are really using financial information to guide your decision making. The third thing is that profitability does not mean that you value money over children. And I think people get a little nervous about saying, I've got to cover my costs, or I've got to turn a profit, or I have to pay for the cover the cost of care. Those are important factors. And you should not think about that profitability and children and caring for children are mutually exclusive. You have to be able to keep the doors open in order to serve the children and families that are so important. If they are the driving decision of why you love your job, profitability allows you to keep kids there in the doors, allows families to keep working, and allows you to nurture and grow that staff that you care so much about. But you can't do it without having money coming into the program. So do not get hung up on the idea that that business can't be part of the equation. It absolutely has to be part of the equation, and that financial information has to drive your decisions. And then finally, I feel so funny saying this because everyone is so stressed and overwhelmed with managing all of these decisions that it feels impossible. But there has never been a more important time to raise your voice as a childcare entrepreneur and advocate for the needs of your small business. We have been hearing stories across the country and from different states of legislators, both at the state and federal level, hearing from childcare business owners and operators, and not for the first time understanding, oh my gosh, you had trouble accessing the payroll protection program? Why? You had trouble applying for an SBA loan? How is that happening? That is really critical. There has never been a more important time to raise your voice and to partner with your Louisiana advocates to fight for the things that you really need. And then I think our final slide is around questions. Oh,
Great.
and then
We have
yeah, there's just our website right there. And then if you've got extra questions, we'll pass them the baton back to Libby.
Great. Well, thank you all so much for the wonderful information. We do have one question so far. When we're starting center-based operations, we are going to be required to adhere to a pretty onerous safety and health management protocol with things like cleaning supplies, PPEs for staff and children, and other essential supplies required. It appears highly unlikely that childcare providers will have the kind of steady flow of these supplies, PPEs, needed. We are competing directly with the needs of the healthcare and first responder workforce, and they naturally receive top priority. What do you recommend we do as a sector about this? Where will childcare providers be able to find significant amounts of funding it will take to adhere to these greatly enhanced safety requirements?
That's such a great question. And you know, that conversation that I just, that point that I just said in that last slide that said it's time to advocate, this is a really good point. Number one, the most important thing to remember is that childcare puts people back to work and it keeps essential workers at work. And that message has to get to leadership, either in state agencies or the governor's office or with your state legislature. And if they believe that childcare needs to reopen with those safety precautions in mind, and they see childcare as critical, they have to create access to those supplies and that equipment as part of their economic reopening strategy. Because childcare is so critical for everyone else going back to work, that message has to get back to the decision-making tables so that childcare is a consideration for making sure that people can go back to work. And I know that's the priority of governors, and I know that's the priority of the legislature. And so if they're going to want that to happen, childcare's access to the supply chain and protective equipment is part of the strategy. So really important for you to carry those messages forward and to ask your advocates to continue to carry that message forward so that number one, you can access it, and number two, you can afford it.
Libby and Heidi, I'd like to add on top of Heidi's comment, when providers are raising their voices and saying, we too are being exposed and putting ourselves at risk, and we want to make sure that we are safe, our staff are safe, and the children and families we care for are safe, you can reference what state governments have done for providers in other locations. In Minnesota, the governor is working directly with a major local grocery supplier to reduce the number of steps in the supply chain for providers. And so they're working with that provider to ensure that food and cleaning supplies are easily accessible for childcare providers. In other locations where grocery stores are open, but they're rationing cleaning supplies, governors have created a letter that is sent directly to childcare providers, and they can present that letter to a grocery store to purchase more than the average person. There's might be a limit on toilet paper, bleach wipes, etc. Providers are allowed to buy more than that when they present this letter. And in both Colorado and Minnesota, philanthropy has stepped in to provide some funding to coordinate access and delivery of supplies to providers. So when you're advocating for whatever it is that you need in order to stay open, reopen, and ensure safety, those are three specific examples that you can reference that might be helpful for you and for your colleagues.
Also, here in Louisiana, our Assistant Superintendent, Jessica Bagian, has a letter for providers to be able to use to do just what you were talking about related to getting cleaning supplies and food and those types of things so that they can either maintain being open or reopen if needed.
Wonderful.
And I don't see any other questions. Just a reminder that the webinar was, oh, here's one more. We are a religious program and our employees are usually ineligible for state unemployment. Louisiana has stated that anyone who is eligible for at least $1 in state unemployment benefits qualifies for the extra $600 federal benefit. But I worry that wouldn't include my employees since their state amount would be $0. Do you know anything about the CARES Act, how the CARES Act would affect employees of religious nonprofits if they were laid off?
Another excellent question. And I don't know the current situation in Louisiana, and I'm not going to pretend to, but I know that there are other states who are grappling with this same concept. So what the person who's asking the question is referring to is the fact that religious organizations can opt out of paying unemployment insurance, and it saves them some dollars. But the flip side of that is if they lay off their staff, those staff people are not eligible for unemployment. So that's a situation that is happening. That is not uncommon, and several states have sort of created some fixes to sort of get around that. They have created some strategies. Molly, are you recalling any in particular?
So I am not, but to the person who's asking the question, I've written down your name from the chat box, and I have, I think, a resource that I can send perhaps to Libby afterwards, who could share it out with other people about an explainer about how some locations have addressed this and what you might be able to do, because you are not the only person in this situation.
Right. I want to point out, I know for sure there are a couple of states who have figured out sort of a way around this, a fix. And so it definitely is something that is impacting not just childcare that's based in a religious organization, but other religious organizations. They have lots of other things. You know, they might have schools, or they might have, you know, lots of other places where this is happening. And so there are some fixes. I'm just not recalling the precise ones, but we can share that back with Libby to share with you.
Yeah, in addition to childcare centers and schools, many states are home to large healthcare systems or hospitals, which are religious institutions. And so this has been a question that's been posed before. So Libby, please expect a note from First Children's Finance after with some helpful information for this provider.
Absolutely. And for whoever asked the question, or if you had other questions that you need direct answers for, I put my email address in the chat box for you all. So happy to share that. And so I think that's all the questions. Again, just a reminder, we recorded this webinar. We will put it on our website at policyinstitutela.org, along with a copy of the presentation. And we can't thank you enough, Heidi and Molly, for sharing everything that you did with us here in Louisiana and our providers.
Thank you for the invitation. We're really grateful to be with you this morning.
Great. Thank you.
We're really honored to chat with all of you, and we hope that you continue to stay safe and be well. Thanks for letting us be with you all today.
Thank you. Goodbye, everybody.